McDonald with talking a little bit about the Johnson & Johnson vaccine. Where are we with Johnson & Johnson shipments here in Rhode Island, and when will we expect to see a bump in those, if at all?
Yeah, I think that's the question, is if we're going to see it again. I mean, right now we're waiting to see what the advisory committee and immunization practices has to say this Friday when they come together. And then it's a matter of a recommendation to the Center for Disease Control. So right now the J&J vaccine is on pause. We don't actually have a lot of J&J vaccine. We haven't been giving any since the pause started. So really right now we're in a holding pattern. We're going to wait and see what happens.
What did you do with people who were scheduled to get the Johnson & Johnson vaccine? Were you able to keep their appointment and give them a Moderna or Pfizer vaccine, or did they have to reschedule for another appointment?
Yeah, so the majority of people were able to reschedule to get a Moderna or Pfizer vaccine. So that's a little different for them because they're going to have to get the booster dose because the J&J was one and done. But right now with the pause, it made the most sense to try to not to cancel appointments, but to get them the booster vaccine when they need it, either 3 or 4 weeks later.
A very close friend of mine got the Johnson & Johnson vaccine like Thursday or Friday, I think, of the week right before the announcement came out. I'm hearing from people who are a little worried. They're scared. They're concerned when the vaccine does come back on the market. Is it safe? What's your advice to people right now who either just recently got it or who are maybe still thinking about getting it in the future, but a little concerned now?
Yeah, I think if you just got the vaccine, keep in mind, the event that occurred, the blood clot, that central venous sinus thrombosis, was exquisitely rare, about 1 in a million. So it was very rare. I'm very glad the FDA and the CDC initiated the pause because to me, they heard a safety signal. They looked at it and they're doing the research needed to find out if it's safe and effective. So I think that's important. And then we'll wait and see if the vaccine comes back because I don't think we know that yet. But if you did get the vaccine, most people had a mild, irritation, flu-like illness for a couple of days, a little headache, achy. That's what most people experience. And that's what's going to happen to most people. That's all that's going to happen. And the side effect that was very serious, the blood clot, is very, very rare, but we don't even know yet if it was associated with the vaccine. So I think this is one of those things where we now know what to look for. There's that old expression, ignorance is bliss, but it really isn't bliss. And I think to some degree, one of the benefits that came out of this was we heard that safety signal. And then people said, well, now we know what to look for. And keep in mind, the 6 people who ended up in the hospital, they were quite ill. So it wasn't a subtle finding that occurred there.
Dr. McDonald, when we talk about appointments for vaccine, we're seeing a lot of appointments for people show up now that everybody's eligible for vaccine in Rhode Island. I think today I went on the site. I mean, there were tons of appointments open. Are we at the point where supply is exceeding demand?
I think we're at the point where the system is working and I'm excited about it. It's interesting. My 3 children signed up for the vaccine interest notification list a few weeks ago. They all got invited to get a vaccine yesterday and all 3 of them got vaccine today. So that was great. And I think what you're seeing is we just had a lot of vaccine this week. One of the things we did this week too was we opened up appointments on Monday. We opened up 15,000 appointments on Monday, which is new for us. And we opened up 9,000 appointments today. So I'm ecstatic that there's actually plenty of appointments right now. And this is a great time to go to get the vaccine with a lot less frustration than the beginning right now. So it's a good time to go. I was at the Sockanaset site today with my boys. It was crowded. Demand still looks very high in Rhode Island, and I think we're heading in a good position here.
Do you think people are reluctant? And are you finding that my age group, per se, the age group that just opened, are they more reluctant? I think we saw appointments filling up in seconds for the older groups, but we're not quite seeing that right now with the younger group.
Yeah, we saw appointments fill up for the older groups, but we had much, much less appointments. With the younger group, we have much, much more appointments. So I don't know that we're seeing people with vaccine hesitancy just yet. I think what we're seeing right now is people have to, one, coordinate their schedules. Keep in mind, you have to get the day off from work or get time off from work, go get the vaccine. You have to figure it out. Interesting enough for today, for my daughter, my wife went to Wenham, Massachusetts to pick her up and drove her down to the Dunkin' Donuts Center, got her the vaccine, drove her back to college. I drove my kids to the Sockanaset site. And part of what I'm getting is we both had the flexibility to do that in our work schedules. Not everybody does. So I don't think it's hesitancy as much as people just need time to organize it and get the logistics done. So I'm not too worried right now that we have extra appointments. I'm actually pretty happy that we don't have that frustration of people sitting at the computer and not getting their vaccine.
Dr. McDonald, let's talk a little bit about cases versus vaccine. You know, about 1/3 of Rhode Islanders are fully vaccinated. But we're still seeing cases kind of plateau. I believe this week might be the first week. Correct me if I'm wrong. They're starting to kind of downtick a little bit, but I think some are surprised that we're not seeing a quicker decrease in numbers. Why is that? And are these numbers concerning at all?
Yeah, I'm not surprised we're not seeing a decrease in numbers because over half the state right now is still susceptible to getting COVID. With over half the state being susceptible, there's still a lot of people who are at risk of getting the disease. Keep in mind, the majority of people we vaccinated were the older individuals. So what you see is we're seeing less people die, and that's great. And that's one of the things we want to see. I am seeing an uptick in hospitalization. If you look at the last month, we've seen this gradual slight uptick in the number of people in the hospital. I think what this is indicative of is the more than likely or not, people who are getting infected with that B117 variant, which is a little more contagious, which I think is why we're getting more cases, and a little bit more severe, which I think is why we're still seeing even younger people end up in the hospital. What it tells me is, and why I'm still a little bit concerned is, the pandemic is still alive and well in Rhode Island. Team Virus is still fighting pretty hard, and Team Human has some catching up to do. And it may not sound exciting, but what Team Human has to offer is we have the masks and we like our masks. We get that. And we have vaccines, but quite frankly, it's going to take time for our vaccines to take effect. Keep in mind, you're not fully vaccinated for several weeks. You got to get dose 1, 3 weeks later, get dose 2 or 4 weeks, and then it's 2 more weeks. So getting a lot of people immunized, but quite frankly, we have a long way to go right now.
When you talk about immunizations, we're talking about a long way to go. We're talking about, you know, people are I think we are seeing amongst younger people, I don't know if you are, but vaccinations are out there. People are starting to get more loose, even though they're not vaccinated. A lot of people are looking forward to summer. If people sign up today for their vaccine, they're likely going to be fully vaccinated just right around Memorial Day now, you know, the start of summer. Dr. Jha saying yesterday that outdoors, you know, we may be able to lift these mask mandates. Are we going to be at a point this summer where I can walk down the street in Newport or Westerly or go to the beach in Charlestown and not have to wear my mask outside?
Yeah, so outdoor is definitely safer than indoors because, you know, one of the things about Mother Nature, she ventilates the planet beautifully, and we really are grateful for that. So outdoors is great. And we have to wait and see what mask requirements are going to look like. A lot of that will depend on how many people we get vaccinated. So if we get a lot of the state vaccinated and our case counts come down, we're going to be in a much better position.
What about going in the direction of states like Connecticut and New Hampshire, where they're reopening in May to their full capacity? You know, you can do whatever you want. Are we going to get to a place like those states, or are we still months behind them? Or do you even see Rhode Island going to that loose and broad of not any restrictions at all this summer?
Yeah, I think we need to go where the data takes us. And I think if we see a number of people get the vaccine and we see our case counts and hospitalizations trend in the right direction, then a lot of things are possible. I think it's more important to get the economy open and then to take away the mask mandate. And keep in mind, you know, one of the things you see in some of these states like New Hampshire that took away the mask mandate is they're still recommending you wear a mask. And a lot of businesses are still going to recommend that, and towns are going to recommend that. So part of what it is giving people the space to see what's possible. I think when we all really get right down to it, though, it's the vaccination that's our way out of this pandemic.
Dr. McDonald, let's talk a little bit about, I just want to go, okay. On the reopening, you know, what are some of the metrics that you're looking at in terms of being able to fully reopen? You mentioned vaccinations and cases are a big one, following the data. What would the data have to look like to get to a point where we can fully reopen and not have to wear our masks anymore?
Yeah, I think it's the population of people that we get vaccinated. So I think if we get like 70%, even a little more of the population vaccinated, that really puts us in a much more competitive position to open an island. You know, so I think we're heading in the right direction here.
75% of the people vaccinated, and I skipped on the last part. Did you mention case percentage?
Yeah, I don't know that it's case percentage as much. Like, in other words, I think number of people in the hospital, you know, is something we have to track of. And then as far as case positivity, I would expect that would go down over time. But I think if we get 70 to 75% of the population vaccinated, we're in a much better position to do that. And we're heading in the right direction right now. We're heading in a very good direction.
Dr. McDonald, anything else you'd like to add on that topic before I get to some others for other reporters and such on reopening, vaccinations rolling out to everybody, the summer approaching, everybody being able to get vaccinated hopefully by the summer? Anything I missed that you would like to add?
I'll just throw this out. If you're a young person considering a vaccine, I'm a doctor and I recommend young people get vaccines. I'm a pediatrician. So when I see my 18-year-old patients or 16-year-old patients, I tell them, yeah, you should get the vaccine. 1, it protects you. 2, it protects your family. And 3, the best way to beat the variants of concern, Rhode Island, is to just not have cases. If we don't have cases, we don't have to worry about the variants.